Hi, my name is Rachel, and my title for the sports injury webinar is Meniscus Tear. So, what is a meniscus? It is a crescent-shaped band of thick rubbery cartilage which sit between the knee joint, between the femur and the tibia. There is two types of meniscus: the medial, which is on the inner side of the knee joint, the lateral, which is on the outside of the knee. The function of the meniscus is to stabilize the joint and protect the bone from wear and tear. A torn meniscus is a tear to the cartilage in the knee joint, which causes pain on the inside of the knee. It damages the joint surface and is often associated with ACL injury. In this picture, you can see the torn meniscus have some white fluid in it. There are several types of meniscus tear. First, we have here the radial tear. Basically, it is short tears that extend from the inner margin of the meniscus and head towards the outer part of the meniscus. Degenerative tear happens along the ears. Next, we have buccal handle tear. It is the entire inner rim of the medial meniscus torn. Flap tear is what we call horizontal meniscal tear. The cause of the injury is simple: direct impact in contact sports, twisting or turning quickly, often with the foot planted while the knee is bent. For example, pivoting in basketball. Wear and tear of the meniscal cartilage in older people, or even repeated or prolonged squatting, can also tear the meniscus. Here is an example of a meniscus injury during a basketball game. Enjoy! You can see Derrick Rose took an outward step right here. His leg was planted to the ground, but the sudden twist of his right knee tore his meniscus. He was limping right after. The symptoms of a meniscal injury are severe intermittent sharp pain, swelling of the knee, or the knee often gives way. Sometimes we experience what feels like a block to moving your knee, or even difficulty bending and straightening the knee. During the injury, a popping sensation will be heard. Complications of the injury. A torn meniscus can lead to knee instability, inability to move your knee normally, or persistent knee pain. Pain is often caused with deep knee bending, walking, twisting, and exercise. Complications also are osteoarthritis, which is the degeneration of the joint cartilage, and medial collateral ligament will be damaged with the meniscus if there is impact from the side. Sometimes a piece of the shredded cartilage breaks loose and catches in the knee joint, causing it to lock up. If your tear is small and on the outer side of the meniscus, it may not require surgical repair. As long as your symptoms do not persist and your knee is stable, non-surgical treatment may be all you need. The RICE protocol is the most effective for sports-related injuries. Rest. Take a break from the activity. Ice. Use cold packs. Compression. Wear an elastic compression bandage. Elevation. Recline your leg when you rest. Also, you can take non-steroidal anti-inflammatory medicines like ibuprofen, aspirin to reduce pain and swelling. And if your knee is not responding to treatment, your doctor may recommend arthroscopic surgery. It is a small incision which is made to the knee. Tools and camera will be inserted through the incision to repair or trim away the damaged meniscus. This is a picture of the knee arthroscopy portals. This is how the operation is carried out. Estimated healing or recovery time is approximately 6 weeks. The outer portion of the meniscus, often referred to as the red zone, has a good blood supply and can sometimes heal on its own if the tear is small. In contrast, the inner 2/3 of the meniscus, known as the white zone, does not have a good blood supply. Tears in this region will not heal on their own as this area lacks blood vessels to bring in healing nutrients. Recommended physiotherapy exercises for recovery are quad sets. It helps you to build and maintain strength in the muscles on top of your thigh. With this action, you are setting these quadricep muscles by holding them tight. Do 8 to 12 repetitions several times during the day. First, sit on the floor, press the back of your knee down, and hold for about 6 seconds. Next, you can try straight leg raise to the front. It is as shown in the picture. Follow these steps, and you're on your road to recovery. And also, you can try hamstring curls. Lie on your stomach with your knee straight and lift the foot of your injured knee by bending the knee. Also, add a calf weight with loops around your ankle. Prevention. We often say an ounce of prevention is worth a pound of cure. Keep in mind that fatigue muscles can increase your risk of injury. Therefore, make sure your body has enough time to rest between workouts. Never abruptly increase the intensity for workouts and make changes slowly. Make sure your shoes have enough support and fit correctly, and always warm up before activities. That's all to my presentation. Thank you.